And you're better off not getting the disease than saying, I have the disease and I am asymptomatic, because you do not know the effect the virus is having in your body. And some of these effects will manifest later, as we have seen the evidence coming, and even prominent personalities. I think I've always said this, even in the US, Richard Quest has written about his experience with regards to how 4 months later he's having symptoms that are manifesting in his neurological system. And even a very famous virologist, Peter Piot, London School of Hygiene and Tropical Medicine, who is a virologist, by the way, has written about how the virus has had a devastating effect on his body, even post-testing negative. So the impact of that is that you need to take prevention to the highest level.
Well, and Dr. Machonda there in that press briefing by KMPDU today, and we're glad that you're here to answer to some of these questions. So from what you've said about the impact of this virus, what are we continuing to learn about this virus as it continues to evolve? And when we say that our frontline workers are in danger, and we are saying that there are far-reaching effects to this, what does that mean?
Yeah, so first and foremost is to actually acknowledge that the disease is called novel, or COVID-19, which means a very new disease. And I think since December and January, now we are into 6 months of this disease. And I've always gone back to what have been the experiences in the other countries that dealt with this pandemic earlier on in January, February, and March, even before we had it in our country. And I've gone even beyond that and just looked at the clinical studies, the case reports, and research that has been done around the virus. And I can confidently state that, yes, the virus there's evidence that it is affecting other systems in your body. The neurological system, we have seen evidence of psychosis, we have seen evidence of what you call encephalomyelitis, which is inflammation in your brain. And all these are present in very diverse ways, including even those who go into coma. I think apart from the respiratory complaints, we've seen evidence of affecting the heart, causing inflammation in the heart, because the virus causes what is called a cytokine storm. Sorry for using that, but it's basically the fever, the lack of oxygen, and the stress that triggers your immune system to react to the virus, overreacting, what is called hyperstimulation, which leads to all these manifestations, even into the musculoskeletal system, where even walking, climbing stairs is becoming difficult. And that brings to core what we've always said, even as a union, is that one, healthcare workers getting infected, we need to create a very solid database. We need to do better baseline investigations with regards to all systems there's evidence that are being affected, because what you're going to witness is that 6 months, 1 year, 2 years, 3 years from now, you will have people or healthcare workers who are infected now having disabilities, from reduced lung functions to heart disease, failure in the hearts, and this will affect their quality of life. And that is why the whole issue of Work Injury Benefit Acts come into play, because COVID-19 is an occupational disease. Second issue is the compensation package. And we have written, we wrote a memorandum earlier on in April to the Senate ad hoc committee on COVID-19, and actually put in their proposal, creation of an occupational disease and injury fund with a seed fund of $3 billion that will cater for healthcare workers across both the private and the public sector. Remember, this is a pandemic, and that it does not choose. And we have to acknowledge that our healthcare system is a mix of both private and public. So these issues of compensation with regards to having those funds, having that clear framework of how we will deal with our healthcare workers beyond COVID-19 with regards to the effects and the after effects of the disease is very important. Of course, the lastly is, in case of mortality, then we must have a clear framework of how we are going to compensate, because 80% of our health workforce, as we speak, and I speak saying this confidently, is that up to 80% is a young population of health workforce, which means they have young families to take care of, they have a very long life to still live, even if they contract the disease now. And so because of that, that becomes the whole crux of the matter with regards to occupational safety and health of healthcare workers. And of course, I mean, the whole issue of welfare with regards to their motivation. Very basic things. I think you've not seen us come out and say we want a salary increment. That has been very clear from the start. All we're asking for is whatever is the simple things that can be done. Promote healthcare workers, pay their salaries on time, make sure that they have access to health. As we speak now, I know a number of counties, and I'll say it like Taita Taveta County, which is not paying their doctors the call and risk allowance that was awarded in the 2017 collective bargaining agreement. The number of counties that currently have not paid the NHIF deductions that were deducted from the salaries. And so what is happening, whatever is coming out now is that they're unable to access healthcare services. They're paying out of pocket. So these simple things of welfare, occupational safety and health, which are very straightforward, need to be resolved.
Right. And we'll get back to that. A number of things you've mentioned there that Dr. Mulo would also respond to on the counties and how they're handling the situation so far. I want us to quickly take a look at feedback and questions. So we do a last round for our guests as they give us their final remarks and respond to your questions. Let's start with slido.com. Michael Wanaoni there saying, are the high numbers good on our side or bad? I'm of the opinion that they're good because they're helping us reach the peak earlier. Cabinet Secretary Kagwe admitted that the PPEs used were substandard. Is this the reason why our health workers are contracting the virus? He goes ahead to say, is the national government helping vulnerable counties in equipping their health facilities? I saw CS Kagwe in Nyeri, Murang'a and Embu with goodies to boost health systems in those counties. Is there anything done to Kajiado, Busia, Bungoma and Mombasa in terms of COVID-19 preparedness? Let's take a look at Joseph Olala here says, the blame game won't be good this time. The health practitioners and Ministry of Education need to sit down and discuss these issues. What is the priority of the government when it comes to spending money borrowed to fight the pandemic? Traveling in counties by MOH is not a priority, but a waste. And Odero Victor here, let's take a look at what Odero is saying. That moment, okay, he's talking about Luya politics. I will not touch that. Let's take a look at what you're saying on Twitter. Then we do a last round for our viewers. I've seen a lot of feedback on Twitter. One of them by Ndongo Wainaina, who's Executive Director, International Center for Policy and Conflict. They released a statement today and they're questioning the government response so far. Decrying that community health interventions have not yet been activated, testing not following a discerning logical pattern after abandoning mass testing. So then what happens next? And on Twitter, he goes ahead to say, that is Ndungu Wainaina there. There's a comment he made here that I'd quickly want us to respond to. All right, I'll find it and pose it to our viewers. Right, it's here. It is very difficult to state with certainty that a definite number of people in Kenya have contracted COVID-19. On any given day, we still don't know the extent of COVID-19 infection in Kenya. We don't know how many people are infected and why they are infected. So perhaps luckily we have everyone on our panel today is a health practitioner. You'll be touching on a lot of these issues. I'd want to start with Mr. Obengo, and of course you respond to some of these things as you give us your closing remarks on our preparedness to deal with the surge. We are here now. The numbers are going up. Health workers are saying that they're disgruntled with the manner in which the government is handling everything, training, PPEs, welfare, you name it. So then, where do we go next? How do we move forward?
Okay, thank you. Over 200 years ago, we had the Crimean War, where one of the heroines called Florence Nightingale nursed the injured soldiers, and actually the nursing profession was born. 200 years from then, today, the year 2020 was declared by the WHO as the year of the nurse and midwife. And today we are nursing the whole world back to health. The global statistics are that we have over 250,000 health workers who have contracted the disease. Out of that number, we have over 600 nurses who passed on because of that disease. The numbers could be higher because of poor data sharing methods. The other day, we did a mass testing of staff at Pumwani Hospital. Out of the about 41 who tested positive, almost half were the nurses and midwives working that hospital. That tells you I'm not really looking down upon other cadres. They are also very, very important, but that tells you that we are so much exposed as nurses at this time.
Right.
And what I want to say is that for now, moving forward, we must train our people because of the issue of understaffing, under-training, and we also under-equipped. We must train our people in case management. We are doing that as with other professional associations.
Okay.
We must equip our people with the right gear.
Right.
And we must employ more nurses and health workers.
Right. Thank you.
I still want to salute. I want to salute health workers for the dedication, and I want to thank the COVID Emergency Fund Board and the Equity Bank for coming to the to assist the health workers at this critical time.
Thank you.
They've spent about 200 million to buy PPEs, and
we don't have too much time. Thank you. Thank you. Let's speak to Dr. Nduku, and specifically, as you give us your closing remarks, what then is the future of global health architecture? What are we looking at in terms of financing, investments, and research in the future? What lessons are we picking from COVID-19?
So first, let me start by some of the comments that came. So I'll try to be very fast. I think one of the questions is what's happening in the communities. And I think the community health strategy has been activated. Over 55,000 community health workers have been sensitized. The trainings are ongoing. They are receiving the data collection. And there's more than almost 60 partners. So this is not just a government alone affair. Partners, including community-based organizations, NGOs, who are part of the community working group, who are actually pushing and ensuring that community health workers become key to our prevention, but also our care strategy, because I think there's a lot of lessons we've learned from a pandemic like HIV. I think the second question is around, not question, comment I want to make is around training. And I think the idea that only 15% of healthcare workers have been trained, I think is not completely correct, in the sense that the number, as Mr. Wachira himself said, a lot of healthcare workers, more than that, have been trained in case management. And then for all the counties, they had training of trainers in the use of PPEs. So we have not necessarily had people coming from the national level to go and continue to train, especially when we had cessation of movement. But TOTs were trained. And some counties, and I think Dr. Muller will mention, if Akisa, you'll just give me a second then to finish this. Some counties were able to actually train more of their healthcare workers. On your last question around global architecture, I will simply say that given the impact of COVID on the economies of the world, on how the world is functioning right now, we would definitely see changes. And all investments, including those that were targeted for other health areas in research, seem to have now been reprogrammed or redirected towards COVID because of its impact. And so we will expect there will be changes, and they'll be far-reaching. Thank you.
Great. Let's speak to Dr. Mulwa now as he gives us his closing remarks. A lot of issues around counties and the handling of COVID-19. You say that a lot of progress has been made. There's been a question of supporting other counties. We've seen other counties being supported by the national government. Is this going to happen to all the counties? Speak to the issue of funding in the counties. We are seeing governors say there's a problem of funding. So right in the middle of a pandemic, how are we handling it without funding?
First, I must appreciate that there has been a lot of effort, like you have mentioned, and I appreciate all the comments around the human resource, the PPEs, the financing, and what the national government has been done. The one thing that I have taken from this COVID-19 response is there has been an extraordinary cooperation between the national government and the county governments in terms of addressing this crisis that we are facing as a country. And therefore, the national government has come out very strongly in terms of leadership, setting guidelines and standards and protocols, and the counties, on the other hand, have come out strongly in terms of implementing those protocols. Of course, we know there are a few challenges. Just like in any system, you would expect there are a few challenges. But the one thing that has come out, and the counties that I've seen the cabinet secretary visit, I think that in the task force there has been resources that have been mobilized, and there has been a sharing that has been agreed in terms of supporting the gaps that exist in the counties.
Right.
And therefore, I am not worried that this support is just being given to some counties.
Okay.
To conclude, I think my message is the one component that we must always remember is that we still have a window of opportunity of continuously engaging the communities. Mm-hmm. As we think about the sophisticated equipment, sophisticated trainings, the basic thing is, like I said earlier and Dr. Nduku mentioned, is the primary prevention. Therefore, continuous engagement of the communities to ensure that we slow down the progression of spread of this disease is what will change. We are not yet there as a country in terms of the epidemic peak. Mm-hmm. And I am sure the health system will be tested a bit more.
Okay.
And with the issues of flow of funds, because this disease has affected the country economically adversely, and therefore flow of funds to counties is a challenge. Okay. But we want to appreciate that the counties already have funds that were received from
Dr. Mulwa.
the national government towards COVID-19.
Thank you very much. We're out of time, but I'd really like to give Dr. Machonda just a minute to give us your closing remarks. We're seeing the government, the 5th Extraordinary Summit, to look at the strategies. What should we not miss in this conversation about how do we move forward?
Yeah. So just to close is that the pandemic upon us is equally a blessing for us. And given that one of the big 4 agenda of this country is universal health coverage, then this pandemic blesses that opportunity right in front of the president to ensure that he aligns everything to achieve that universal health coverage agenda. So as we go, as we await the summit, yes, we look at capacity in terms of bed capacity, equipment, the oxygen that Dr. Nduku mentioned about. All that is the infrastructure for the healthcare system. Mm-hmm. But equally then they must consider the human resource component with regards to running concurrent with this healthcare investment, healthcare infrastructure and equipment. Without the human resources for health, will not have achieved anything.
Great. Thank you very much for joining us on the front row. That's how we wrap it up here. Our guest tonight, Dr. Nduku Kilonzo, member of the COVID-19 Response Task Force, as well as the CEO of the National AIDS Control Council, Dr. Chibanzi Machonda, Acting Secretary General, KMPDU, Dr. Andrew Mulwa, the Chairman of the National County Executives for Health Forum, and finally, Alfred Obengo, the President of the National Nurses Association of Kenya, joining us for this conversation. It's a discussion that we'll keep having. Thank you for engaging with us on this episode. A lot of questions and feedback. We appreciate you always joining us here. I am Akisa Wandera. I'll see you next Tuesday on the front row.